Come on. Wow.
God.
Yeah, I know. I apologize, Britt.
You're good.
Grab my opposite shoulder. Nice. Another little baby click.
Oh.
Super productive.
Yeah. Oh, man.
What's up, everybody? Dr. Alec here at Kalkstein Chiropractic. And today, a face you haven't seen before because she's a reluctant participator. This is Britt, and she is at the front desk. She's the first smiling face you see when you walk in the door. So she's a big deal around here. Britt, what is going on today?
So just the constant low back pain.
Okay.
And then still the left arm from here to here. I have to soak it in biofreeze like every morning.
Really? Mm-hmm. Okay, and you don't have any left-sided neck pain?
No.
That's pesky. Okay, so I'll take a look at that. So predominantly low back pain and upper left arm pain.
Right.
Get face down for me, Britt.
Okay.
And you can lean on it. You can crush the mic.
Okay.
It's all good. So this is a situation where I'm gonna work on her and kind of examine as I go here. But I've worked on Britt before, so I know what I'm dealing with. Your upper back runs a little stiff too.
Yeah.
Oh, it runs really stiff.
I carry a lot of stress there.
Everyone has a spot. Sheesh, Britt. Okay.
No.
So take a breath in for me. And all the way out. So that was great. That was perfect. Are you in one piece?
Yes.
Okay.
For now.
Yeah, another one right here. Take a breath for me, Britt. Oh, yeah, that's perfect. You okay?
Yeah.
That was also a good one.
It felt good.
Perfect. Could I get you on your side facing me, please? To your left.
Okay.
To your left.
Okay.
Excellent, excellent. Just see what's hiding in the low back.
Sorry.
See,
Okay.
undoing everything I'm doing here. Come on. Wow.
God.
Am I really beating you up like that?
Yeah.
Good Lord.
And,
Okay. Yeah, I know. I apologize, Britt.
You're good. Thank you. I definitely needed it.
That first one I did, I was just seeing if you were a faker.
Oh, yeah?
Seeing if you do it. Okay. Definitely not a
Sorry.
faker. Relax your hip.
Okay.
Cool.
A faker.
Faker! So just chill out there. I'm gonna mess around with this arm. Let me know if I can trigger any of the symptoms in your upper arm.
Okay.
But let me ask, is it pain that you feel?
Sometimes, yeah, especially when I first wake up, and then
Okay.
it just becomes annoying.
Is that so will you ever get like numbness? Will it tingle? What will you perceive in your arm?
It tingles, and it's just, honestly, just a lot of, like, pain, like I had an arm day or something.
I should, okay. Okay. So you're gonna feel tension build up in your wrist, and probably a couple other places.
Okay.
Keep your head in neutral for me.
Okay.
Depress this shoulder. What do you feel with that?
Tightness.
Where do you feel tightness?
Right where?
In
right
the area
here.
that bugs you?
Yeah.
Okay. So for anyone who's interested or cares, I'm doing upper limb neurodynamic testing right now, and this is essentially just me trying to expose any potentially like subclinical neural tension that she's not perceiving as emanating from her neck. And right now I will do something called structural differentiation to hopefully tell if this is a nerve root issue or if this is a peripheral nerve entrapment, so like maybe like a more TOS-y thing. So I'm gonna do it again, and you feel the pain in that area.
Yeah.
Bring your right ear to your right shoulder. So instead of rotating your head, do like a full, like bring your head over.
Towards you.
Like a that, as opposed to a that, a that.
Gotcha.
So we'll do it all just in sequence.
Okay.
I know there's no easy way to give that instruction.
Do it now.
Do you feel it?
Yeah.
Now do it. And hold it there.
Okay.
Does that make it worse?
A little, but not really. It's
Not
still
really.
just, it's irritating.
So bring your left ear to your left shoulder. Does that make it any better?
Yes.
Does it really?
Yeah, it definitely does.
Okay. Come back to the middle. So upon structural differentiation, so using her head to draw her cord to the contralateral side and tug on the ipsilateral nerve root, it appears to have both triggered and relieved some of the pain, which is giving me the implication that potentially this is a cervical nerve root that is creating the issue in her arm, and that it's not a peripheral nerve entrapment in her subclavius scalenes or like maybe her pec insert. So now I'm gonna bias her ulnar nerve.
My finger, that kind of hurts.
That hurts on your pinky, right?
Yeah.
Does it hurt anywhere in your arm?
No, not now.
If I let go of that pinky, does it pretty much stop?
No, it kind of feels the same.
Feels the same.
Yeah.
Go right ear. Sorry, I'm gonna make you hurt a little bit here.
Oh, God.
Go right ear to right shoulder. Does that make it worse?
Honestly, no.
No, okay,
But
cool.
I'm just focusing on the finger.
I got you.
Okay.
So negative on the ulnar nerve, and now I'm gonna bias her radial nerve.
Yeah.
What do you feel with that?
Pain.
Pain where specifically?
Honestly, it's like right below the armpit. Like right here is really irritated right now.
Okay, I got you. I'm not gonna let you leave today without doing something about that, now that I've
Okay.
stirred the pot.
Thank you.
Of course. So you feel that right now?
Yeah.
Go right ear to right shoulder. Does that make it worse?
No, it's same.
Go left ear to left shoulder.
Better.
Better. So it doesn't make it worse to tug your head away, but it does make it better to bring your head in.
Definitely. Yeah. I don't know why.
Well, we're gonna figure that out. So it seems like at the minimum there is some central component to what Britt is dealing with in her arm. And when I say central, I guess technically it's peripheral. I'm saying that her nerve root in her lower neck is at least a little involved. So now I'm just gonna start jamming on the spots where these nerves that supply the upper arm are typically gonna get caught up. So it's hard to know exactly what you're touching here in the brachial plexus because there's several nerves that I'm strumming. Like everything I'm strumming there, those are nerve and vascular structures. Like that's not muscle or tendon. If I press there, do I trigger anything in your arm?
Not really. When you were moving your fingers back and forth, that did.
Okay, so now I'm like really gonna go for plexus.
That's irritating.
Is it really?
Yeah.
To the rest of your arm?
Not really, just like more up here. But it starts here, then it like radiates down.
Do you ever feel anything occur between your neck and this position? It is exclusively here to here? Okay. So like I'm really gonna try to find her pec insert because that brachial plexus slides right under it. If I pin like this tissue, I know that sucks. Do you get anything in your arm?
No, it actually is starting to tingle in my hand.
Tingle in the hand, and that's common too because I'm pressing on those nerves.
Okay.
So then I can come up here and find like her subclavius, which is also probably pretty tender.
Yeah.
Is that doing anything to your hand, upper arm?
I'm still feel tingling in my hand and my upper chest hurts.
Yep, that's my bad.
You're good.
So now, like the last spot I'm gonna really touch on her are her scalenes. So the way you find a scalene really quick is you pop this up. You can see the SCM jump kind of right out. And the scalenes are gonna be pretty much immediately posterior to that SCM. So as I press in here, Britt, do you feel anything?
No, not in the arm.
Okay, just right under my finger. So there's an anterior, middle, and a posterior scalene. So I know that I'm biasing the anterior one there. I can't tell if I'm going mid or posterior, but I'm gonna slide backwards and try to get something. How about when I'm back here?
Very slightly.
Slightly where?
Honestly, I don't know if it's from previously that I'm still feeling it.
Just me messing with it?
Yeah.
Yeah, no, that's totally fair. And the last thing I'll do is come right down onto her first rib, which is always more superior than people think. Give that some juice, because that's where the scalenes insert, because they are an accessory muscle of respiration. Do you feel that? Mm-hmm. Obviously you feel the pressure on my thumb, but
right.
But nothing in your upper arm?
No.
Okay. Just because I'm super curious, I'm going to come back here. And I know you can't see my fingers, but I'm going to essentially slide right off of her spinous process, kind of into this little groove. Yeah, and see if I can catch her nerve root.
Yeah, that's sore.
Sore right under my hand.
Mm-hmm. Yeah.
Okay, so at this exact moment, I can't be perfectly sure if it's a nerve root issue or if it's like a peripheral entrapment in her pec. I'm leaning towards neck right now. I'm gonna treat both though. I'm gonna treat some of those peripheral entrapment sites with some soft tissue and just kind of like some general stretching. What I'm gonna have her learn is nerve flossing, because that would kind of be the perfect. I'll have her learn nerve flossing and cervical Mackenzie's for something like this, just to cast a wide net of what could potentially help her here with this nerve pain. But I'm going to work on her neck as well and see what we can do. So I'm just going to do a little bit of soft tissue on your neck and adjust it.
Thank you.
Of course. And how long has this been going on, Britt?
The arm, probably, I think it's been like 2 months since I told you and Dr. Nick.
Okay. And the thing that can fake you out about this is that there's a phenomenon in the body called a somatoreferral, which is where a peripherally irritated nerve will refer discomfort back to the root from which it emanates. And a radicular presentation would be the exact opposite, which is where a nerve root refers peripherally. So that's the only reason I can't be 100%. Although the structural differentiation, that's not a perfect science, but it kind of points me in the direction that maybe the neck is the causative agent in what's going on with Britt. So right now, I'm essentially just pinning her scalenes, and she probably doesn't appreciate it a ton. And then I'm stretching them, laterally flexing it away. Are you okay with that?
Yeah.
I'll put a little rotation in there. It's probably going to be a little less spicy than me just purely laterally flexing her. You okay with that though?
Yeah.
I know she carries a lot of tension in her upper back, and she probably doesn't appreciate that pressure that I'm putting in.
Yeah, that kind of hurts.
Yeah. But her traps aren't all that tonic. She's not all that overactive there. So I'm actually going to come around. I'm going to adjust her first rib before I adjust her neck. See if I can get the scalenes to release first. So look to your right for me, Britt. Grab my opposite shoulder. Nice. So that gave way just a little bit. You okay there?
Yeah.
Did you feel that click or no?
I felt a little bit,
Just
yeah.
a little baby click on that one. So grab that shoulder now. Another little baby click.
Yeah. Oh.
Super productive.
Yeah. Oh, man.
Wow. So that was good.
Yeah.
Your neck was pretty stiff.
Mm-hmm. That didn't sound real.
Some people think we put fake cracking tracks on the videos, and we just don't.
Yeah.
So let me ask this, is your arm irritated right now?
Not really.
No,
It's
okay.
really bad in the mornings.
Mostly bad in the morning.
Mm-hmm.
So I'm not gonna mess with it too much if she's good right now, especially after getting her neck worked on. I kind of wanna isolate that variable, see if that's something that contributes to it. So if I desensitize her nerve root, I kind of want to see if that makes a difference in that upper arm pain. There it is. crunchy elbow. So from a manual therapy standpoint, I'm probably not going to do too much more today. Maybe we'll do an addendum with her if it turns out she's not really dealing with a nerve root issue. This isn't a radicular thing, and it's more peripheral. We can do some additional soft tissue work for that. But I am going to have her learn nerve flossing and Mackenzie's, and if you want to see that, I've already recorded a couple other videos on that, and I think the most recent one is with Sabrina, so you can check that out. But yeah, that's how we're going to treat front desk Brit today with her low back pain and this semi-mysterious upper arm pain. Thanks for watching, everybody. Don't forget to subscribe, and we'll see you next time.